to this interesting and very exciting conference about prostate surgery. I'm coming from Germany. It's in the western part of Germany, and I'm very lucky to be able to be part of this conference here. So there should be someone doing some kind of translation, but just in case, there is on your right side already a translated copy of my slides. So first of all, I want to invite and tell you something about the lasers in general, and then go into detail. So laser was invented about 100 years ago, so it was described by Albert Einstein, and then we have now different lasers in urology for our treatment, and here we have some data about different types of lasers in urology, and I want to talk about thulium laser today, and especially thulium laser of the second generation, which is a very strong laser in hemostasis because its absorption coefficient is very strong in water, so we have excellent hemostasis in water, which is needed because we are doing our surgery underwater. So just in case, perhaps we might have some translation now.
Да, коллеги, я буду переводить Армина. I mean, just make pauses when you...
Yeah. So I'll do the next slide, and then we will have a short pause. So with this laser, we are able to do different treatment modalities.
С этим лазером можно выполнять несколько видов операций.
So you can see in the middle we have enucleation, vaporesection, and vaporization.
Это энуклеация, вапорезекция и вапоризация.
And on the left, you might see, if you go for a large gland, it would be easier to do an enucleation, but if you, for instance, have a high-risk patient, you would go for vaporization.
А на левой стороне, с левой стороны представлены различные условия проведения операции. То есть, если это большие железы, то лучше идти на энуклеацию, а если это пациенты высокого риска, то лучше делать вапоризацию.
So, and first described in 2017, thulium laser operation methods for prostate were described.
И впервые первое описание тулиевых энуклеаций были сделаны в 2007-2008 году.
There we had two different trials comparing thulium laser resection of prostate tissue with normal standard TURP.
И одно из исследований – это сравнение резекции с классическим туром.
And the authors concluded that the learning curve for thulium laser resection is like TURP.
И кривые обучения были сравнимы по длительности.
So it's a good technique to start with, but the PSA drop down, which is something telling you about the amount of tissue which has been removed from the prostate, is just by 56% in comparison to 80 to 85% of HOLAP. So a lot more tissue removed by HOLAP.
И если сравнивать уровни ПСА, падение уровня ПСА, то в случае вапорезекции это 56%, а в случае холипа это 80-85%. И падение уровня ПСА говорит о косвенно количестве удаленной ткани.
And the next video should show you how vaporization works, how it could be performed. So we see an endoscopic view of a pretty small prostate, and here's the surgeon is doing some kind of chips bigger than TURP, but still small enough to be evacuated through the sheath.
И вот как работает вапорезекция. То есть она сравнима с туром, когда хирург нарезает так называемые чипсы с помощью лазера, которые потом могут быть эвакуированы после операции без использования марцелятора.
So you see good hemostasis, but the problem is you have to reach the capsula like with the TURP, so it's understandable that this technique is fine and safe, but not as effective as an enucleation.
Уровень гемостаза достаточно хорош, но понятно, что если сравнить количество удаленной ткани, то с энуклеацией эта процедура, конечно, не сравнима.
Another technique which is a little bit fast, it's the tangerine technique. So it's like a tangerine on that side to see. So the surgeon has some gaps in the prostate and tries to get a bigger portion out of the prostate in one piece.
И так называемая техника мандарина, когда нарезается не очень не малыми кусочками, а чуть больше, как раскрывается мандарин.
I think the next slides are pretty clear. We saw it already in the auditorium. So this is the technique how to do a 3-lobe technique. Mostly it's done in en bloc technique. But when you do an enucleation, you have to be sure that you have a morcellation tool as well, or you do mushroom technique. But when you compare the two techniques, the efficacy of getting the specimen or the tissue out of the bladder is much faster if you're using a morcellation than you do the mushroom technique.
И, естественно, если сравнивать две техники полной энуклеации и с последующей марцелляцией и так называемую грибовидную технику, то скорость проведения операции при использовании марцеллятора, конечно же, выше, нежели будете использовать грибовидную технику.
Because in the mushroom technique, the surgeon resects the tissue which is still adapted, attached to the bladder neck, so it's not free in the bladder, it's resected, and you're 10 times faster if you do morcellation.
Ну, да, и с марцеллятором в 10 раз быстрее.
And just to show you some seconds of vapor-enucleation by the thulium laser, this video might show you the advantages of a thulium laser enucleation if you have a look at hemostasis and control of the tissue.
И это видео уже вапоэнуклеации, и вы можете видеть, насколько хорош гемостаз при использовании тулиевого лазера.
So with this laser, you are also able to do an anatomical enucleation of the prostate. So with this laser, it's easy to incise the tissue. If you have the holmium laser, sometimes you don't see clearly and it's not a precise incision. With this laser, you have a precise incision.
И с помощью тулиевого лазера также можно делать анатомическую энуклеацию, и если сравнивать с големем, Армин считает, что гораздо легче делать эти надрезы, и вы больше контролируете движение, лучше визуализацию.
And once you have a fine incision of the tissue on the prostate, you can easily go into the cavity and go into the plane between the adenoma and the capsula.
И вы легко можете найти вот тот самый слой между аденомой и капсулой.
And you just follow the plane with a laser for coagulation. And here is a study comparing vaporisection and vapoenucleation done by Nate from Hamburg. And they did this study of patients' thulium laser without morcellation, so it's a vaporisection. And on the right hand is thulium laser with morcellation.
Это работа, которая сравнила результаты вапорезекции и вапоэнуклеации. Соответственно, вапорезекция была выполнена без марцелляции, а вапоэнуклеация с последующей марцелляцией.
And what was statistically significant, it was the time of operation. It was shorter than the resection.
И время операции в случае вапоэнуклеации было значительно меньше.
So to conclude about this study, enucleation was fast and more effective, and it was just done for small prostates in this study. So I think the advantage of enucleation might be greater for bigger glands, which showed other studies.
В этом исследовании были взяты только просто небольшого размера, и, естественно, в случае, если говорить о больших простатах, то скорость операции будет, возможно, значительно.
So let's come to the endoscopic enucleation of the prostate. Here we have a comparison of ThuLab and HoLab, as again done by Nate and Gross, a big clinic in Germany doing a lot of HoLab and ThuLab. Both had more than 500 operations done, each technique.
И вот исследование, посвященное сравнению техник тулиевой энуклеации и гольмиевой энуклеации, выполнено профессором Гроссом и Нетшем в Германии, более 100 пациентов.
They could show they were dividing the groups into two same groups, randomized trial, and 2-VAP, and which was the thulium enucleation of the prostate, was again faster, so enucleation time was shorter, which is also sure that efficiency is greater with thulium.
И в случае тулиевой энуклеации время операции было меньше, соответственно, говорит о неком преимуществе тулиевых лазеров.
So, and what we heard just some minutes ago, it should be the anatomical endoscopic enucleation of the prostate. This should be the aim today. And there is a study, a review of 8 different studies with more than 5,000 patients.
И что касается вот той самой анатомической эндоскопической энуклеации, есть исследования, 8 исследований, суммарно больше 5000 пациентов.
And again, here they had a look at the PSA reduction after the prostate operation, and we have more than 80 to 90% of PSA reduction with enucleation, whereas we have for resection only 60% and vaporization only something about 50%.
И опять же, если обратить внимание на уровень ПСА, снижение уровня ПСА после операции, то в случае энуклеации, да, это 80+, а в случае резекции эта цифра 50.
So the author came to the conclusion that resection or vaporization is less effective if you compare it to an enucleation, and it's comparable to open surgery if you're doing a good enucleation of the prostate.
И энуклеация более эффективна и сравнима с открытой энуклеацией.
And what is special with this kind of laser I was giving you the operation today is also something which is called cool cut technique. So we have less carbonization, less effect to the tissue, so the operator can see clearly where he has to go, and this area after the procedure is less when you compare it to, for instance, green light laser vaporization.
И что касается вот того лазера, на котором была выполнена сегодня операция, это режим Cool Cut, который дает меньше термического поражения. Если сравнивать, например, с зеленым лазером, то уровни количества дизурий гораздо ниже, меньше карбонизации.
But still a clear effect on the tissue, so you can follow the plane and do the enucleation under vision.
И благодаря этому есть возможность оставаться в слое и контролировать процесс энуклеации.
So let's come to the conclusion. For thulium laser, enucleation is most durable and effective. That's for sure. This is the anatomical endoscopic enucleation of the prostate might be the gold standard in the future for prostate surgery. Nevertheless, it's okay. Nevertheless, which adenoma, how big the gland is, vaporesection or vaporization with thulium laser is a good modality if you have patients at high risk, like anticoagulant, or you don't want to, or you don't have a mosulator, then you go for vaporesection or vaporization. And you have to tailor your strategy to do the operation with your patient's needs. That's for sure. So, are there any questions?